If you have trouble sleeping and you're snoring and you're keeping your partner awake, you might be suffering from sleep apnea. The problem might stem from your teeth. Joining me today from StoneRidge Dental Care, Cynthia Levy. Cynthia, thank you for being with me and for bringing this to our attention. Sleep apnea is not new and not a new condition.
Not at all.
But having it to do with the teeth, it's not something I never heard of.
It's really not that it has to do with the teeth, it has to do with airway. And we actually now know, even sleep apnea is a chronic condition. It can be debilitating. It's a very dangerous condition. But in dentistry, by manufacturing a certain type of bite guard, sort of like a night guard, we can actually open the airway and help with sleep apnea.
The kind of same, say, for people who bite their teeth or clench their teeth at night, that same type of appliance or something different?
Not really, it's different. It's actually what they call a mandibular repositioning device. It actually opens the airway and keeps the patient or the person breathing at night.
Can they sleep if they've got this device?
They can. They can sleep a lot better than what they do with what has traditionally been used, which is a CPAP. And a lot of people who are listening who have sleep apnea or have a partner who does, CPAP has always been considered the gold standard. It's a mask with tubing, and it pumps positive air, and it makes noise. 25% of married couples don't sleep together because of snoring, because of sleep apnea, because of CPAPs. And it's estimated that after the first year of use, only 25% of people are actually using their CPAPs. So there are all these people with sleep apnea who are walking around, diagnosed, suffering, not wearing their CPAP.
So this could be another cure, you might say,
It's another treatment. It is actually now the American Academy of Sleep Medicine has said that for mild to moderate sleep apnea, a mouth guard or the mandibular repositioning device is probably the first line of treatment.
That's amazing. And now, do you ever couple the two treatments together, or doesn't that necessarily work?
Sometimes it does. In severe cases, sometimes you can do that.
What is sleep apnea? I mean, we've been talking as if people would know what it is, but give me more of an explanation so that our audience might understand if they don't know what it is.
It's a condition where people literally stop breathing many times throughout the night.
It can actually be dangerous.
It's very dangerous. Untreated, it has a higher incidence of linked with heart disease, stroke, daytime sleepiness, accidents. The insurance industry has actually said that people who suffer from sleep apnea have a higher incidence of accidents,
because they're not getting in their sleep.
They're not getting sleep.
And this is caused by not enough air getting in, and so that causes them to awaken.
And if you're a partner, if you know someone, if you sleep next to someone who has sleep apnea and they snore and they're waking up gasping for air, you can tell. So
where do you get this treatment? How do you find a dentist that could actually help them?
Well, you need to research and make sure that you find a dentist who's had training in sleep medicine, not placing snore guards, and that's something really important. A lot of dentists will place a snore guard. Patients will come in, the wife will say, he snores, it's terrible. So a lot of labs make these snore guards. Well, the worst thing you can do to someone who has apnea is silence them. You shut off the snoring. The snoring and that gasping is what actually will cause a partner to wake up and say to their partner, wake up, you're snoring. If you silence someone with sleep apnea, it can be deadly.
Because then they're really not getting the breaths that they need.
They're not waking up. That noise isn't happening. It's not causing them to wake up.
Is there any age that this seems to hit people at? The older folks, I don't know, over 40, over 50? When do we start to see it more?
I think it is a little bit more. I don't know the exact statistics. I know that it's linked to obesity. And as chronic obesity increases in this country, sleep apnea is just on the rise.
Well, this is amazing because it's good news and it's wonderful news to help save people's lives, but also a much easier treatment, apparently.
Much easier. It's much easier to put something in your mouth, sort of like a night guard, that keeps you open and keeps you breathing.
Especially if you want to visit and you have to bring all the stuff with you and all those things.
It's great for traveling. It's really wonderful. And there are so many people who just won't wear their CPAPs.
Yeah. Cynthia, thank you. Nice to see you.
It's a pleasure to see you.